President Biden is ordering flags to fly at half-staff as the U.S. marks 1 million COVID-related deaths. Both Johns Hopkins University and the CDC expect the nation to surpass that number later this week. This morning, the president acknowledged the, quote, tragic milestone by calling each death an irreplaceable loss. The president also urged Congress to pass a $10 billion COVID funding package. He says without that money, citizens may not be able to receive COVID testing, treatments, or vaccines.
We're going to face together global health crises. This is not the last one we've had. It's not a question of if, it's a question of when. So we have to invest now. We have to secure political commitments now. We have to start working to prevent the next variant and the next pandemic now. And that's going to require all of us to do more.
CBS News senior White House and political correspondent Ed O'Keefe joins us now with more from the White House. Hi, Ed. So, of course, President Biden is asking Congress to pass that stalled $10 billion COVID funding package. Can you remind us what's in this package and why it hasn't been passed yet?
Yeah, well, let's start with what is supposed to be in it. Essentially, they're asking for more money to buy more vaccine, more treatment, more medication for people who may fall ill from COVID-19. The idea being, of course, remember that these vaccines have been essentially free for most, or if not all, Americans at this point, and they want to maintain that ample supply going into the fall when the Biden administration warns things could tick up yet again, as they did last year. Also, money in there to fund the ongoing push to get vaccines around the world, and then money to help prepare for future pandemics and make sure that not only the scientific research continues, but that the public health and safety preparedness aspects of this, whether it's buying supplies or doing research or preparing for other potential public health disasters, is also there. Why it's being held up? Well, for one thing, the price and the scope of what the president's asking for. There's disagreement on whether or not to include the aid for other countries around the world or whether just to focus on what's going on here in the United States. Those that support what the White House is trying to do say, look, this has been a global pandemic. If someone's getting sick on the other end of the world, inevitably it's going to find its way here to the United States. You have to be helping the rest of the world combat this as well. The other issue is whether or not Congress is going to end up having a bit of a proxy fight, if you will, over an aspect of the pandemic that bleeds into immigration policy. It's known, of course, as Title 42. It was put in place during the Trump administration. It allows federal border agents along most of the southern border to expel almost immediately migrants who cross for public health reasons. This was put in place by the Centers for Disease Control and Prevention during the Trump administration. Democrats in this White House argue it's an unnecessary and unfair tool that's been used to keep people out. There is a court case that's set to be heard again tomorrow, challenging the CDC's decision to end this policy at the end of the month. What Republicans and some Democrats in Congress are proposing to do is tack on to that funding request at least an amendment vote that would say that Congress is essentially blocking the administration from stopping the policy from ending at the end of May, and that that needs to happen because they don't believe the Biden administration has done enough quite yet. It bleeds into immigration politics, midterm election politics, and the fact that there are enough moderate Democrats in agreement with Republicans about holding that vote means Democratic leaders on the Hill have to thread a needle and figure out how to get that funding done and either allow that vote to happen or try to hold it separately.
Right. And that, of course, today marks that devastating toll of a million deaths from COVID. The White House is now warning we could see another 100 million COVID infections this fall and winter. So, Ed, what is the administration doing to get ahead of this next wave?
But what they don't say in that same breath, Tanya, is something that they've acknowledged in the finer details of that warning, and that is the infection rate could get that high if and only if Congress doesn't cough up the money that they're asking for. So it is a dramatic warning and threat, but it is designed for political reasons to try to compel Congress to act by scaring the general public into thinking there could be that many cases if what they're asking for in terms of vaccine and other supply is not made available, expanding testing and whatever else. So it's a notable scare tactic, frankly, by the White House to suggest that it could get that high if and only if Congress doesn't act. So that's part of what they're trying to do to compel Congress to do it, is to say, look, at our projections right now, if we don't get what we need, it could climb that high. But if we do, hopefully it won't.
It is a shocking number quoted there. All right. Ed O'Keefe at the White House, thank you so much. We appreciate it.